Barotrauma is an injury to lung tissue that results from overexpansion and increased levels of pressure. We created this video to cover the medical definition and provide a brief overview of this topic. So, if you're ready, let's get into it. As previously mentioned, pulmonary barotrauma occurs when too much air reaches the lungs and can result in alveolar rupture or injury. This can occur in patients receiving mechanical ventilation when too much positive pressure is applied. When this happens, it can damage the structural integrity of the alveoli, leading to serious medical conditions, one of which being a pneumothorax. Other examples include Pneumomediastinum, Pneumoperitoneum, subcutaneous emphysema, and a bronchopleural fistula. As a respiratory therapist, one thing to keep in mind for patients receiving mechanical ventilation is that once the peak pressure gets above 50 centimeters of water pressure, then you need to start worrying about pulmonary barotrauma. As long as the peak pressure is below this threshold, the patient is generally not considered to be at risk. However, each patient is different, of course, so this may not always be the case. Barotrauma is also a potential hazard when using a bag mask device during manual ventilation. That is because too much air can be squeezed from the bag into the patient's lungs. However, modern adult-sized devices are now made to hold less than 2,000 milliliters of air, which greatly reduces the risk of barotrauma under these circumstances. Again, for this video, we just wanted to provide you with a brief overview of this topic. We'll be breaking it down into much more detail in a separate video. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well because we have a ton of other videos on our channel that I think you will enjoy. Just a quick reminder, we are not doctors. This video is for educational and informational purposes only. And if you want to dive deeper and learn more about this topic, you can go to respiratorytherapyzone.com where we have a ton of free study guides, practice questions, and other helpful resources. I'll drop links to everything you need right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.